Hello, everybody who's joining us. Welcome to our webinar Wednesday today. We're just going to wait as a few of the attendees trickle in. It usually takes a few seconds and we'll get going. There we go. Wow. I see a lot of familiar names jumping in. So hi, everybody. Again, thanks for joining us. There's still a few people jumping in, so I'll give them a couple more seconds and we'll start. For those of you in the lower mainland like me, or at least where I am on the North Shore, the sun is starting to come out. It's all of a sudden getting bright and gorgeous. Okay, and I think we're up to 18, 19, 20. We're still climbing. I'll give it one more minute just to make sure we don't miss anybody. All right. I think we will get going. Thank you so much to everyone who has joined us today. My name is Jahan Casey. I am the Director of the First Nations Public Service Secretariat. And this webinar today is brought to you on our webinar Wednesday as part of our First Nation Mentorship Initiative here at the FNPSS. I know that most of you are signing in from across BC or even other provinces. I am coming to you from the wonderful territory that I have the privilege to both live and work on. It's the unceded traditional territory of the Squamish, Tsleil-Waututh, and Musqueam First Nations here in BC. And like I said, it's starting to be sunny. I hope it's equally as beautiful where you are. Like I said, I'm the director of FNPSS, and we are a provincial level organization mandated to support administration capacity building for First Nation governments and organizations across BC. I am Haida, proud to be Haida, a member of the Skidegate Indian Band. And this is, I have lost count, I want to say 19 or 20 of these webinars that we have done since we've moved into this virtual world. And thank you everyone for joining us. This particular webinar we are doing as a repeat, although with an update, I think, and some information. It's on tips and guides for reopening your offices and supporting your employees as you return to a entire or partial work in the office going forward. We ran a panel at our virtual forum that we held a little while ago, and this was one of the most popular elements of that forum. So we wanted to do a repeat. We also wanted to make sure that we had a recording. So we are recording so that we can share this virtually after on all our social media channels and our website. And hopefully it will be of use. So before I jump in and introduce our guest speakers, just a quick housekeeping. Someone's already said hi in the chat. Thank you to everyone. So on the bottom of your screen, if you hover here, you'll get a little chat box where you can jump in and say hello. Let us know you can hear us or see us, or if you're having any issues with that and you can't. Right a couple of icons over from that is a Q&A button. If you have any questions, hi from Ottawa, someone's here from Ottawa, wow. If you have any questions as we're going through, if you pop up that box, you can type your questions in there and we'll read them out and make sure the panelists read them. And any questions we don't get to, because we do only have an hour today, we'll try to follow up with through our Facebook group or posting in some other manner. And the panelists have PowerPoints, and just because we'll always get this question, we will make sure to share those decks and any information they talk about with all attendees by email after the chat. Hi, Debbie from Wet'suwet'en. Thank you all. Okay, so since you want to hear from them, not from me, they're by far the more interesting group of our panel. The two women that you can see here on the screen with me, at the top of my screen, I'm not sure where she is for yours, is Siobhan Hutchinson. Maybe she can give a wave. She is a Labour Standards Inspector with the Government of Canada, with the Federal Labour Program of Employment and Social Development Canada, where she's worked for over 3 years. And she's going to primarily provide information on Part 3 of the Canada Labour Code, but I know from experience now, having had her on a webinar, has a wealth of expertise and information she can share. The second smiling face there on the screen is Melissa Morden, who is a safety officer at Employment and Social Development Canada. She has worked there for over 6 years, and Melissa has presented at a number of our training sessions. So anyone who's come to one of our HR management training sessions has probably seen Melissa. And again, we always have more questions than we can ever get to for Melissa. So please type them in and we'll try to get to them. Last but not least, we were having some tech difficulties, but he's trying valiantly to get back online, is another frequent FNPSS presenter. Robin Henry is the Director of Human Resources with Namgis First Nation, and he is of Tlingit and Ventet ancestry from the Yukon Territory. And like I said, he has worked with us for a number of years now, and has a wealth of experience managing HR and First Nations to share. So hopefully he can get on here and share his information. He's also just jumped in from a council meeting. For all of you who work in First Nations, you know how you're having to balance about 4 hats at once. So what we'll do is we'll start with Melissa, and hopefully Robin will jump in. And like I said, if you have questions, please jump in and add them in the chat at any time. So with that, I'm going to turn it over to Melissa to get us going.
Okay, thank you. Okay, so my name is Melissa. I'm a health and safety officer with ESDC with the labor program. So what I'm going to present on today is just a review of the employer obligations for returning to work in a safe manner. So for those of you who are not aware, ESDC is the federal regulator for occupational health and safety. And I would just like to acknowledge that I live on the traditional unceded territory of the Lekamel and the Stalo First Nations. So just for those of you that haven't had any experience with ESDC, so our job is to do site inspections, investigations into complaints, do these kind of information sessions if you were ever wanting someone to attend your site. So we have quite a variety of things that we do. Okay, so firstly, I'm just going to briefly touch on jurisdiction. So jurisdiction is probably the more complicated component of the presentation today. So I'm just going to try to simplify it so you know if you fall under our jurisdiction or if it might be federal or provincial. So if you are working for a band or a nation administration, so the administration office, if the housings department, public works, those kind of things, if it falls under the actual administration of the nation, that is going to be federally regulated. So you are going to have to follow what ESDC enforces. If you are working for a healthcare component, an education component, development corporations, forestry, all of those things, if they are run separate from the administration, they may or may not be federally regulated. So you're going to need to do a little bit of more research to determine if you are working for one of them, who that's going to fall under, if it's going to be WorkSafe BC for safety or for us. Even if you are paying workers' compensation premiums to WorkSafe BC and you are working for a band administration office, you would still have to follow our jurisdiction for safety. Okay. So if you are a federally regulated entity, so if you are working for the administration, you are going to be knowledgeable in the Canada Labour Code Part 2 and the Canada Occupational Health and Safety Regulations. So those are the two main pieces of legislation that will apply in terms of getting your employees back to work safely. And there are links on a resource page that I believe Jahan is going to share with you guys. So one of the sections of the Canada Labour Code is the duty of employers. So the duty of the employer, section 124, outlines that every employer must ensure the health and safety of every person employed by the employer. So any person that you are paying as an employee needs to be protected against all sorts of hazards within their workplace. This obligation also exists when the person is at work or if they are performing work duties. So if they are, say, on a paid lunch or they're traveling for work, that still counts as work. And there are also some general duty clauses to keep in mind, where there is an obligation for the employer to keep all persons granted access to the site safe as well. So this would include members of the public coming into your offices and that kind of thing. Okay, the Hazard Prevention Program. So this is a part 19 of the Canada Occupational Health and Safety Regulations. So this is where you're going to be dealing with all hazards in your workplace. So this program is a general program used to address any hazard. And this is the program that you would use for assessing the risks of COVID-19 exposure and that kind of thing, and reopening your workplaces. And just also keep in mind that a workplace is any place where an employee is engaged in work for the employer. So if you have, say, home care nurses that are going into the homes of members, those workplaces, so the homes of those members would be their workplace, and you'd have to include that in your assessment. This program is meant to be a joint effort. So this is supposed to be a joint effort between the employer as well as an employee members of your safety committee or your health and safety representative if you have less than 20 employees. So this is supposed to be in conjunction to make sure that there is fairness and equal representation to make sure that the needs of employees are heard. This program has several components that you'll need to be aware of. So you would need to have an implementation plan, so where you would identify kind of what areas of work need to be assessed first. You would also need to have a hazard identification and assessment methodology. So this would be where you're choosing your hazard identification tool, whether it's a job hazard analysis, a risk analysis, all of those kind of things. So you would select how you're going to do that. Then you're actually going to have the hazard identification and assessment component, preventive measures, employee training, and program evaluation. So those are the main components for this program that you would use to identify the risk for returning to the workplace. So specifically related to COVID-19, what the obligation of the employer is to complete a hazard assessment related to potential exposure to COVID-19 in the workplace. From that assessment, you're going to determine which preventive measures will be implemented to address the risks and hazards that you identified. And then you're going to train employees on the hazards and the preventive measures that you're going to be implementing. So those are the three things that you're really going to have to focus on if you're going to be returning to your workplace. So preventive measures. So these ones can get a little bit tricky, so I'm just going to go over a little bit. So preventive measures must be selected in the following order. So number one, you're going to try to eliminate the hazard. So the hazard can be eliminated by restricting the number of people in the workplace so that you can ensure that you are always maintaining social distancing. If you are not able to eliminate the hazard, then you have to focus on reducing the hazard. So reducing the hazard can be done through engineering controls, where you might use things like barriers to prevent public from exposing your employees, or even between employees if you have a number of people working in the same space. After reducing the hazard to a level that you can, you would then implement the use of personal protective equipment. Now for COVID-19 exposure, there are a number of different types of equipment that you might use. So this might include gloves or respiratory protection. So you might be able to find some N95 masks. You might choose to use a medical grade mask instead. You can also use face shields, like the plastic face shields that would come over, which come in a variety of styles. If you are having some issues procuring N95 masks, which some employers are, Health Canada does have a publication right now that goes over kind of what the next level down would be, and so how you would select what you should use if you can't get N95 masks, depending on what type of work you're doing. So you might want to take a peek at that. And then after personal protective equipment comes administrative procedures. So that's going to be things like changing your cleaning processes, traffic control for hallways, spreading out the times that people are working, or having people come to the door and you let them in, those kind of things. So there's a variety of different measures that you can use to address this for returning to work. Okay, some guidance material. So again, this material is on the resource sheet that I believe Jahan will send out. So we have a hazard prevention program guide, which is published by ESDC's labor program. It goes over all of Part 19. The only issue with it is it doesn't specifically cover the issue of pandemics. So it doesn't go over COVID-19 exposure specifically. It's just going over that general requirement to do a hazard assessment. If you are wanting something that's a little bit more specific to the hazards associated with COVID-19, you can look at the COVID-19 Safety Plan Guide, which is published by WorkSafe BC. WorkSafe BC's guide is very broad, and yet it's quite specific in terms of the actual kind of risks associated with COVID-19. If you are a federally regulated entity and you are using that document, just know that that is voluntary. And there are some things that you would not necessarily have to do. So WorkSafe BC requires that this plan be posted and that kind of thing. We don't have that same requirement. It also, just keep in mind that they do have the order of preventive measures is different in the WorkSafe's plan than for ESDC's obligations under Part 19. So just to make sure that you're comparing those two if you're going to use the WorkSafe's plan, because I do know that it might be easier for you to use one plan versus multiple. So you can look at that if you're looking for some helpful information. Oh, and also we would not expect you to show us your safety plan or your hazard assessment unless we got a complaint or something to that nature. So this would just be for your records and the records of your safety committee and your employees. And sources of information. So our website is listed here. So there's lots of information there. Again, general information that doesn't specifically relate to COVID-19, but you can find all sorts of safety information. The 1-800 number that I've listed here, if you have a question, you can call that number, and the occupational health and safety folks, so someone like myself, we will call you within the day. So if you're looking for a quick answer, that is probably the best place to go. If you want to just give them a shout, and then we'll call you back very quickly. And then along with this is my email address. So if you have any specific questions related to the material I've presented, or if you are looking for something else related to safety, or you're looking for an information session for your committee or for just your staff, you can absolutely just shoot me an email and I'm happy to answer the question to the best of my ability. Okay, and that is the end of my presentation.
Thank you so much, Melissa. And I see at least one person has put a question in the Q&A. I'm going to ask Siobhan to come on and go through her information. And then we'll go back and we'll answer all of the questions all together at the end. So thank you so much, Melissa. Keep adding your questions to the Q&A. We'll try to get them. And I will turn it over to Siobhan.
Hi, everyone. I hope you can hear me okay. I live right next to a train track, so I really hope a train doesn't go by. Otherwise, that will make this very hard for all of us. So my fingers are crossed. So like we said at the start of the presentation, I am a Labour Standards Officer under Part 3 of the Canada Labour Code. And so that's your labour standards. So generally the boring stuff, so your wages, termination, stuff like that. And I will be focusing today mostly on changes that were made to Part 3 of the Canada Labour Code and some layoff information. I'm not in BC like most of you. I am in Calgary. So I do want to acknowledge that I live and work on the traditional territories of the Blackfoot Confederacy. So the Siksika, the Kainai, the Piikani, as well as the Tsuut'ina, the Stoney Nakoda Nations, the Métis Nation, and all people who make their homes on Treaty 7 territory, or region, sorry, of Southern Alberta. And thank you very much for having us here today. So I'm going to try and share my screen with you and go through the PowerPoint presentation. I'll be going through it pretty quick to leave as much time as possible for questions later. So hopefully you guys can see that okay. So there we go. So the first thing I'll be touching base on today is the leave relating to COVID-19. So this is a temporary leave that was implemented just a few months ago to address everything that was happening with COVID-19. So what that means is that employees are entitled up to 16 weeks of unpaid job protected leave if they're unable or unavailable to work because of COVID-19. So some examples could be if they're asked to quarantine or self-isolate, or if they need to care for a family member as a result of COVID-19. The big thing with this is that it is unpaid leave. So the employer does not need to pay their employee while they're accessing this leave. It's just job protection. So it would be similar to maternity leave, where they cannot be terminated or fired for accessing this leave. Even though it's not paid by the employer, that employee still might be eligible for something like employment insurance through Service Canada, or the emergency response benefit, which I think is from Canada Revenue Agency. For an employee to dip into this leave, they do need to provide their employer with a written notice as soon as possible for the reason of their leave and how long they think they'll be off. And also they need to notify their employer if there's any changes. So let's say that they were asked to self-isolate for 4 weeks and something comes up and it has to stretch to 10 weeks. As soon as they're made aware, they do need to inform their employer. And the last thing I want to say in regarding to this leave is right now it is a temporary provision that was put into the code. So it's not expected to be permanent and always be there. It's only there right now until September 30th. So on October 1st, it will be repealed and that leave won't be there. Keep in mind that might change depending on how things go. But right now, this leave is expected to end on September 30th. So one of the other changes that was made to the code is the temporary removal of medical certificate requirements. So you'll see there that there's a couple leave provisions listed, like medical leave and compassionate care leave. Previously, for someone to access those leaves, they had to go to their doctor and get a note if the employer requested it. Because of COVID-19, employees are no longer required to provide that medical certificate. Again, this is a temporary change and is only expected to last until September 30th. But again, keep a close eye on things and see how they shake out. It might change, but right now the plan is that until September 30th, if employees are requesting any kind of those leaves there, like medical leave or compassionate care leave, they don't need to get a doctor's note or a medical certificate, I should say. I'm going to completely kind of switch gears now and touch base in regards to layoffs. This was something that definitely took up a lot of our time as labor standards officers, as a lot of employers, because of COVID-19, had to lay off some of their employees. A layoff is different from a termination. So a layoff would be an employer doesn't have any work right now, so they can lay you off and expect to recall you. And then, then you would go back to work. But sometimes a layoff can turn into a termination if it goes past a certain period. Generally, that's about the 3-month mark. In terms of layoffs, the Canada Labour Code doesn't really provide a lot of information. But what I can tell you is that it is all of the information you need to know about it is in Regulation 30 of the Canada Labour Code. An employee's continuity of employment is unaffected, even if there was a layoff. So for things like vacation pay, or down the road, if it happens a termination or a termination occurs, their continuity of employment isn't affected just because they were laid off. So if I worked for an employer for 5 years, was laid off for 2 months, came back to work, and then worked for another 5, I would have been considered to have worked for 10 years. Just because there's a layoff doesn't mean that there's a restart of their employment. It's important to note that the employer's responsibility is to pay the employees for wages once they return back to work. So when an employee is laid off, the employer doesn't have to pay them wages, but once they are working, it's kind of back to normal. They do have to pay wages and their general requirements under the code. And the biggest thing that I can suggest for employers, but sometimes even for employees, is the importance of record keeping. So for layoffs, it's very important to keep record of their layoff date and the recall dates. So if there were letters or notices sent out, those should be kept. There's another regulation that talks all about records that need to be kept, and the benchmark is at least 3 months, but you can keep them for much longer, and a lot of employers do. So that's kind of a quick run through of the layoff information. There was a very recent change that was made to layoffs. Previously, in most cases, an employee could be laid off for up to 3 months, so 90 days, and it would still be considered a layoff. It wouldn't be considered a termination until the end of that 3 months, or if they had a recall date down the road. But they have changed that. For COVID-19, what they have done is they've basically extended the layoff period until the end of this year. So if someone was laid off, let's say, on April 15th, before the change came through, in most circumstances, that person would have to be recalled within 3 months. But now that date is extended out until December 30th. So that person is still considered laid off and not terminated. So if it comes to a termination, severance and termination pay don't have to be paid until the end of the year, so December 30th, if there was no recall date. So I hope I explained that change. Okay, it is pretty new to us, but it is a pretty new change, and it is a pretty big one as well for employers to keep in mind. So similar to Melissa, here's our contact information for the labor program. We have the same 1-800 number, so if you have any questions in regards to labor standards, they're a really great resource. If they don't have an answer for you right away, they'll take down your information and they'll give you a call back once they do have the answer. And there's a link there, and I've also provided a resource sheet to the organizers. There's a lot of really great general information in regards to the code and labor standards on our websites. It might not be the most interesting read that you'll ever have, but if you're having trouble sleeping, I'd recommend taking a look through some of the things. It'll put you to sleep, but it's also really good information to have. So definitely take a look. And if you're curious, we also have a Twitter handle that also apparently they post a lot of stuff on there as well, and you can see a lot of updates in regards to the code on there. So that's it for me. I know I kind of rapid fired all of the information, so I hope it was clear, and if not, I'm definitely available for questions as well.
Thank you so much, Siobhan. And I'm going to bring Melissa on to And we'll start running through because there are a number of questions in the Q&A. And before I do that, I'm going to say that my apologies from Robin, who is partially due to our Zoom issue. And unfortunately, it's just part of working in a First Nation. The connectivity was not great and he had trouble getting on initially. And then now has trouble getting back on. So I promise if he manages to make it, the poor guy's been texting and trying, we'll bring him up. Otherwise, we'll make sure to get him on again. So for the questions that we have, the first one, Melissa, I'm thinking is directed at you. It came in during your presentation. And the question was, why would the plans regulations differ? So referring to your presentation, you spoke about plans with different regulations and why would they differ? And is one rated higher or better for First Nations to use?
Okay, so why they are different, no idea. So I really, sometimes, especially with the Canada Labour Code and the regulations, they're kind of slower to progress because of all of the government processes, whereas WorkSafe BC, they can change their regulations a lot faster. In terms of one being better than the other, it's not really, it doesn't necessarily matter. It just matters whose jurisdiction you are falling under and what plan you need to make sure you are compliant with. If you are working for a nation that has other entities, so if you are working where you have federally regulated and provincially regulated components within your nation, it might be easier to just use the WorkSafe tool, even if for the federally regulated components, because then you're not having to do the same thing twice. It's just a matter of just making sure that you're being compliant with both. And so really the differences are not substantial. So it's just a matter of just making sure that you review both before you do them. If that helps.
Thank you. I think I followed that, so thank you. I guess last question, and this is probably for both of you, is would you be the appropriate contact for all of BC if First Nations had questions on either of these topics? Maybe Melissa, go ahead.
So at least for occupational health and safety, we don't have main contacts, but if you want to reach out to me, I'm happy. If I'm not able to help, I can pass your information along to an officer or my managers that can assign someone to help. But if you are looking for a quick answer, I would say just call the 1-800 number.
And Siobhan?
I would say my answer is the same as Melissa's. I would say for labor standards, your best bet is probably to contact that 1-800 number, because inspectors, we have a lot of very deep knowledge about a few things that we deal with very often. But an example would be, if someone asked me a question right now about maternity leave, I wouldn't be able to give you an answer because I never deal with it. Whereas the 1-800 number, they have such a wide variety of questions that come to them. And they also have the opportunity to kind of go back to their team leaders and do some research. So I would say if you have a general question, they're probably your best bet. But if anyone wants, say, a specific seminar or something like that, or they want help on an issue, they can reach out to me as well, and I'll see if we can help.
Great, thank you. And for everyone who is sitting there going, oh, I don't have those 1-800 numbers anymore, we will definitely be sharing out the decks from both of them by email with everyone who's registered and posting them on our website. So if you know someone who wanted to participate and didn't get it, they can access those decks and get those contact information as well. So don't worry, you'll have ways to get a hold of both Siobhan and Melissa. And I think that leads into another question I have here is someone was wondering if you can do a work session with their particular council or their senior team members. I think I know the answer to that, but I'll let you do that as well. I see nods. I'm thinking yes. So Melissa, Siobhan, reach out to the same contact information.
Yep, if you email either one of us, if you're looking for occupational health and safety, you can send a request to me, and if I can accommodate it, I will. If not, I will pass it along to an officer that can. And we just need a medium like this to be able to do them, or on the phone.
Great. And Siobhan, I'm guessing the same answer for you.
Exact same answer. It's a little bit different now because of COVID-19. We used to be able to travel and go and visit and meet people in person, and we can't do that anymore, but definitely if it's just a call or a video call like this, similar, if I can't accommodate it, I'll send it to my manager and she'll kind of put you with another inspector. But we're always happy when people want to talk to us, so ask away.
I feel like you might be inundated with requesting, which is a good thing. I'm glad you're happy about that. So this is a bit of a deal. It's a specific question, but I feel like it will likely apply to others. So Crystal, apologize as I go through this question here. She's indicated she hired a worker a month ago. They haven't yet passed their probationary period. They went to the city and came back to the community. The worker is a homemaker for elders. So the band and the elder asked the homemaker to not go into the elder's home for 2 weeks, but did not fire the employee. So her question is, does she have to pay the newly hired homemaker for the 2-week period when she couldn't go into the elder's home and do that job? Thinking that's Siobhan, probably.
The quick answer would be no. It's tough for me to give you a 100% concrete answer because I don't know all of the specifics, but my general answer would be you only have to pay them for work completed. So if they were able to go to work and do work, there's nothing for you to pay them for, is how I would answer that question. If they haven't done work, there's nothing to pay them for since they were at home for those 2 weeks. So I hope that answers the question.
I think in general, yes. And of course, I think for everyone, we all understand that, you know, the devil's in the details. And so, yeah, for any of those types of questions, a legal response is usually your best bet. But again, Crystal, I think if you wanted to reach out to Siobhan for a more in-depth conversation, she'd probably be happy to talk to you. She's smiling, not telling me, not holding up an angry finger at me. So I think that's a yes. And yeah, hopefully you have some legal help you can get. We don't recommend lawyers, but we work with some, so feel free to reach out to FNPSS if you want some help with that. So here is a question that I've heard many times. For employees working remotely, so say from home, like I am right now, there is still considered the work site and the safety plan. Do those apply to that work at home site, Melissa?
Yes, it does. So if you have people that are working at home because you have asked them to, or because that is the safest way for them to work right now, this does count as their home, as their workplace, I'm sorry. And so what you would need to do is have, include a component within your assessment of what your employees need to be considering for safety at home. So with ergonomics, risk of exposure to other things and those kind of things. So you would need to include that for sure.
Perfect. And this is a question that came in by email, but I've been asked before too. As far as things like, you know, if an employee is injured, I don't know, they bang their head on their desk at their home office or something like that. Are things like workers' compensation and all of those, do they apply equally no matter where you're doing your job? Like if you're doing your job at home?
If you are working at the time of an injury, then yes. If you were in the kitchen because you were going to get a snack, maybe not. But if you are at work, then yes, workers' compensation would apply.
Great, thank you. And what if, well, I guess if people are working from home, they're probably not having guests in their home for meetings, but it would apply the same way, I guess, if someone had a meeting in their home. It is the work site, is that correct? Oh, it gets so complicated. Okay, so here's a question about maternity leave. An employee was on maternity leave and due to return to work, but the office is now closed. Is her position no longer available? Or if an attorney was on maternity leave and then due to return, oh my goodness, this is complicated. With her position to be terminated, would she be provided a layoff following maternity leave until the office is reopened? What are some of the options for dealing with an employee who should have been returning from maternity leave?
That is a very hard question. I would say, I think to give you the best answer possible, I would recommend that you call the 1-800 number because they would know more about this than I would. We very rarely as inspectors deal with maternity leave. And there's, I think, a lot of detail there that I couldn't give you a quick answer right now. So I'd recommend calling the 1-800 number. Generally, if you're in one leave and something happens, you may be able to access another kind of leave. So she might have finished her maternity leave and may be able to may go straight onto a layoff until she can be recalled to work when the office opens or something like that. That might be an option. But I'd say to give you a more fulsome answer to contact the 1-800 number. Sorry.
That's perfect. I think, again, we want to make sure people get the right answer, but the general advice is useful. So a couple of questions from question from someone in the north. I know your answer about finding a contact would be to contact that number and then they'd find an individual in your office to help. Are there any northern, geographically located northern representatives from either of your offices? No, I'm saying.
No, so we have offices in Vancouver, Calgary, and Edmonton. But any one of us, we normally are able to travel, and we do northern BC quite a bit, as well as all across the province. So it wouldn't matter kind of where you're located. If we were able to travel, we would be able to come to you to do a session or do those kind of things. So anyone can help, regardless of where we are based.
Great. Thank you. So again, just for everyone, we will make sure that you all get all the contact information so that you can follow up with any of those. So we only have a couple more questions, which is great. We're going to get through them all. Again, this one's a little complicated. Northern Health has had successful provincial models against COVID-19, which has generally been hard work for communities to protect their members. The question is, if staff was granted annual leave and plan to travel outside of their safe zone within Northern Health, can they regulate or impose when staff choose to travel outside that area? Or is that something an employer can in any way control? I'm seeing blank faces. Maybe it doesn't fall within your scope. Siobhan, do you want to elaborate or perhaps suggest if you can answer that or not?
The only thing that I can say to that is that if an employee is planning on taking leave and they may be traveling on that leave, under the code, that leave that they take has to be, I want to say mutually beneficial. I don't think that's the language in the code, but basically when they take leave, it has to work for both the employee and the employer. So basically both of them have to agree. So that might be something that you want to kind of keep in the back of your mind, that if they want to take off leave and then travel and then say they have to quarantine for 2 weeks afterwards, if you want to work with them, that is definitely something under the code that it says that, you know, within reason, the parties have to work together to decide on that time. But that's really the only thing under the code that I can think would address that situation from a labor standards perspective.
Great, thank you. Okay, so I'm gonna jump in. There's more questions coming, so please keep them coming. Just when I thought we were done, I knew we couldn't possibly be letting you guys go that easily. A question, do I have to pay my band office and health center staff additional pay as they're still working but closed to the public, since they are deemed to be essential services workers?
The quick answer is no, you would pay them at their regular rate of pay, but that's under the Canada Labor Code. I know some provinces, I think there was specific pay bumps for people who were deemed essential workers, but that was not through the labor program. So I couldn't tell you too much about that. You'd have to go back, I guess, to those organizations or that public office. But under the labor program, it doesn't say anything in regards to having to pay them more just because they're essential.
Great. And I know in BC there was a discussion about that. And Crystal, because most band offices fall under the federal regulations, we don't have a provincial rep here, but we definitely have contacts with them. They've been on panels with us before. So I can make a point of sharing a contact with the provincial rep or a link that you could reach out to for that question too. And hopefully that can help answer. So another question here, is there a checklist of things that need to be done to reopen? Essentially reopen, but not open to the public. There's a clarifier there. And if there's staff working remotely from home, what parameters have to be looked at if they don't feel safe to come back to work or don't have childcare? If they give the option of the unpaid 16 weeks, what would be the process for that? What are the other suggestions you have for employers if their staff just don't feel comfortable coming back to the office for work? Maybe Siobhan, I can ask you to jump in and try.
This is another tough question because I think it falls out of what Part 3 of the Canada Labour Code really says. And it's a question that we've gotten before in regards to employee, like the office is open, but employees don't feel safe going back or they're not able to take transit. That's really outside of the code. So it would likely be better, you might get a better answer if you spoke with legal counsel and maybe like an HR rep. What I can say though is that there's a couple of options available. If you're laying them off until they're able to come back to work, that's an option. There's a few different provisions for layoffs that can kind of extend the time frame. So generally we say 3 months, but now it goes until basically until the end of the new year, or sorry, until the end of this year. So if they are comfortable, you know, being laid off, or if that's the only option, that's something you might want to consider. You know, maybe they can work remotely. I would say definitely take a look and can, you know, discuss with that person kind of what they would like to do to go forward. All I can say in terms of the code is that there are leave provisions available you might be able to dip into, but it would definitely not be something that you could, or I shouldn't say definitely, I would say that it would be hard to prove cause for termination if that's something that an employer were considering. But other than that, I think if you wanted a more fulsome, more specific answer, legal counsel or even an HR rep might be able to give you a better one because that's just not really covered under the code.
Thank you, Siobhan. I'm going to say that again. I'm a little bit heartbroken that Robin wasn't able to get on due to technical issues because, while not a lawyer, I know that he has experienced situations like this in his work with First Nations and would probably have advice. So for all of you, don't despair. What we'll do is I will get Robin. I know I can twist his arm into doing one of these or doing a Facebook Live or something so we can help to try to get him to share his experience too. We also do have an HR lawyer that we deal with regularly. So if there's interest, we may invite him to participate on one of these in the future too. And I think that relates to a couple of the others. There was a question again, if an employee can't work because of childcare. Siobhan, you touched on that, but is there anything specific if an employee has an issue because of childcare that they can't come into work? Is laying off the option then?
This is another one where the code doesn't come near to broaching that topic. I really wish that it did, but the code, at least for Part 3, is the bare minimum for like the most frequent circumstances, and COVID-19 and everything that's happened has been so exceptional. It's just not built to kind of meet a lot of these questions. You know, layoff is the first option that comes to mind. There might be other ones, and for other workplaces or for other, you know, like professionals like HR reps or lawyers who deal with this more often, they might be able to let you know what other workplaces have done. I think this is a time where a lot of people are kind of innovating. So that might be an option as well.
Great. So a question about the employee, if during a layoff they choose to take the 16 weeks of leave or for a layoff, is the employer obligated to continue paying or providing extended health coverage or pension contributions? That's for you, Siobhan, as well.
That's another good question that I couldn't answer to you off the top of my head because I think it depends. I think that would be another one for the 1-800 number. They would be able to give you a fuller answer on that one than I could. Sorry, I feel bad. They're definitely better equipped to give you a proper answer than I would be.
That's okay. I think in general, my preference is, you know, don't answer if you don't know. We'd rather send them to the right people. So I appreciate that. And like I said, we'll send out that 1-800 number. So one more question. Is there an obligation of the employee to not engage in, quote, risky behavior? So that is to follow the rules, to not expose themselves to COVID-19, And if they get it, would they take unpaid leave to recover? I guess that might be a sticky legal question. How much can you ask if the employee is at fault for any of that, for want of a better word? Siobhan, do you have any thoughts on that?
Sticky legal question is probably the best way to describe that one. Yeah, that's definitely not covered anywhere under the code, and it really depends on kind of what you're looking for and what their code of conduct are, like what is that employee made aware of those conditions of their employment. Definitely for a proper and fulsome answer, legal counsel would be your best bet for that one.
Thank you. So I know we've touched on this, but I'm going to flip the question a little bit. So this is the question again: if employee doesn't think it's safe to return to the office, even though the employer has done everything that they're required to do for COVID-19. And we've touched on this question, or I think you've responded to that question, but add anything you want. Melissa, it's occurred to me, what if an employee, after working from home for a period of time and the office has been closed and they've been required to work from home, says that they no longer feel their home is a safe place to work? What would the employer's obligation be there?
So if someone feels that they are being put in danger in their workplace, so danger would be a serious or imminent threat to their life or health, they can invoke the right to refuse dangerous work. If they invoke that right, then the employer has an obligation to investigate that hazard and determine if a danger exists or not. And then there is a process from there. If the employee still refuses, then one of the health and safety officers would make a determination. It's no different than if it was in your actual office or something like that.
Although just for from an employer's perspective, a little bit harder to,
yes,
a lot harder to assess that. So I'm guessing if someone actually had that situation come up, calling your office for advice would probably be a good place to start.
Yes, and really, if someone thought that their home was a danger for them to work in, then maybe they would need to return to the office.
Okay, thank you. So we have one more question. We've got a couple minutes left. Who should be responsible to monitor the system checklist daily? So for example, if the employee arrives to work with slight sniffles, they had a recommendation to send them home for 10 days. Who covers the cost? She's thinking for a school teacher in particular, but for any employee, what do you do when your employees come in with sniffles and you send them home? Who does that, and how do you handle that? Any thoughts from either of you? Siobhan, no, I'm getting head shakes. What about the return to work plan? Sorry, go ahead, Siobhan.
Yeah, that's another one where maybe it would really depend on like your HR policies. Again, like if the person's not working, they may not have to be paid by the employer, but it depends what the employer sends them home as. Like what if it's, you know, personal leave? There's a couple paid days under personal leave. It really depends. I think that's another case where for the best answer, maybe an HR professional might be the best one to kind of lay out who and how they would kind of regulate that.
Melissa, are you jumping on there or just touching it?
Yeah, we don't have, there's nothing specific to outline anything like that under Part 2 either.
Okay. As far as that being a safe workplace, I guess, that there's not sick people there, who's responsible for that, for ensuring that that's corrected? Is it the employer or part of that, the safety committee that you've set up and other things under the regulation?
It's ultimately the employer's obligation.
Mm-hmm. Always comes back to the boss, right? So I want to thank everyone. I do want to, just from some of the other webinars that we've done, and I am by no means an HR expert, so this is not legal advice or even HR advice, but we've heard from a couple of First Nations that are just recognizing that they're asking their employees to maintain the ability to work from home occasionally, with the assumption that if they do have sniffles or their allergies are acting up and they're not sure if it's allergies or a cold or what it is, that they can still work from home and trying to be flexible with that. So I know it's just one of the practices that we've heard. Also, all of the First Nations that I've spoke to, their health managers have been spending a lot of time and money in revising and ensuring that their policies on sick leave and personal leave and all of those are up to date so that there's clarity for employees on what type of leave they can take. And we have a Facebook group that is a group of band administrators and others that work in First Nations. And usually if you have a question like that, or you want a template from another First Nations of their HR plan or how they've addressed their policies, you can type a question in there. We'll make sure to share the link to that network group as well. It's also on our webpage, and you usually will get responses from a number of other First Nations that are quite happy to share their best practices and templates from what they've done. By far, one of the best resources is just our colleagues and other First Nations. And we're gonna go, we have 2 minutes left, so I will go to this last question that was just typed into the Q&A. How do you handle injuries in the workplace under COVID? Because during emergencies, PPE are not immediately ready. Melissa, do you have any thoughts on that?
Like injuries in terms of during emergencies? Okay, so I'm not sure. So if you were talking about injuries in the workplace where you're going to need to summon medical assistance, those would just work as per normal. You should always have something in your first aid kit, whether it's a medical mask or something like that, to assist in those kind of circumstances. And then otherwise, if it's just in terms of reporting requirements and investigations, obviously that can be a little bit trickier right now when you don't have everyone kind of in the same place to investigate.
She's added a little bit of a clarification. The questioner has said, what about accidental cuts from someone saying maintenance and they cut themselves, that kind of issue?
I would say that it would be handled as it would normally, just with additional measures in terms of since you can't maintain social distance. I would say that you would need to use a minimum of a medical mask or a face shield of some sort.
Everything's a little more complicated. So I want to thank our 2 panelists, and I am going to thank Robin Henry as well, because I think he spent the past hour trying to get on the computer. And like I said, we'll get him in. There was 2 questions that were dealt with in the chat and I didn't answer. One individual was wondering if there's an opportunity for my panelists to speak on sessions on bullying or violence in the workplace. And I see Melissa has said yes. I know that from previous experience. So if that is something that's of interest, we would be happy to do a broader session on that topic, perhaps. If people would like that, let us know. We will always take suggestions for FNPSS webinars, but sounds like Melissa can also support with something from that if you reach out. And the last question was someone looking for, again, templates of people's HR plans or policy updates related to COVID. So what I will do is I will go in and ask some of my, the HR managers that I know from First Nations and see what we can share with folks to give you samples of what that might look like. And we will definitely be doing more of these. We were holding them about once a week. On topics of interest, but we are going to at minimum do them once a month, and we're offering other training sessions related to some of our regular core training on policy development, how to write a good policy, what to think of when you're updating a policy, HR management more generally. But as always, if anyone listening today has questions or topics that they think they would like a webinar, a session or training or anything on, let us know. You should get an evaluation survey popping up in your web browser when you leave, so please fill it out. We always want to do better, and we really take your feedback to heart and try to do a better job next time. So again, I want to thank so much Melissa and Siobhan for taking their time out of their day in the middle of the week and for doing the session for us again. And ladies, don't think we won't be asking for this again. As Melissa knows, once you're on our list, we come back all the time. So thank you so much for your time. Thank you, all of you, for your support today. Hawa, I raise up my hands to all of you for the work that you're doing in your communities every day, and have a wonderful rest of your day. Be safe. Thank you all.